Today is full of opportunity to connect with others, grow as a community, and even improve lives. And AARP is in Nevada, helping to make it all happen, with resources to help you steer clear of fraud, helping to make our community accessible for all, and fun and educational events all over our state. Because AARP has real value for you, your family, and for everyone in Nevada. So let's take on today together. Learn more at facebook.com/AARPNV. Good morning and welcome everybody to our special stream today here on the properties of AARP Nevada. Make sure you visit our website, aarp.org/NV. And I appreciate you guys all being with us. Hope you're having a great week. It's warm out there. Make sure you take care of yourself. Make sure you stay hydrated. We have an excessive heat warning in the south. I know it's also warm in the northern part of the state. So make sure you protect yourself and others who could be susceptible to the heat out there. All right. Well, the reason we're here today is to talk about Nevada's special legislative session that concluded last week, and a lot of tough choices amid the COVID-19 pandemic. The state has had to make a lot of tough decisions, and so we wanted to get together with you and update you on how it impacts Nevadans 50 plus and what AARP has been doing to make sure that all of the things that you all rely on here in the state as you age are protected. And that's obviously something we do at AARP Nevada, is we make sure we're looking out for you and for those in our state that age and are really reliant on some of the services. So joining me today, starting at the bottom there on your screen, is our state director, Nevada State Director, Maria Moore. Good morning, Maria, and thanks for being here.
Good morning. Good morning, Scott. I'm so pleased that we're able to bring up-to-date information to our members and the community. Thank you.
Yeah, it's so very important. And then the man with one of the best beards in the entire state of Nevada now, thanks to us all staying home, is our Director of Government Relations. That is one Mr. Barry Gold. Good morning, Barry. How are you?
I am great. Thanks so much. It's great to be here, and I'm looking forward to sharing the good things that happened during the special session for AARP members and a lot of the most vulnerable in our state.
And to start off, I'd like to just a little bit of background in that we don't have a session every year. We have it every 2 years. And to have a special session during COVID-19 was really something to pay attention to. So right off the bat, I want to ask Barry about what we really track during our regular session, which is home and community-based services. And Barry, what can you tell us about what happened and what we mitigated? What's the outcome of the special session when it has to do with home and community-based services?
Absolutely. It was an exciting session in terms of getting what we needed. Home and community-based services are those things that keep people living in their home when otherwise they might be eligible to go to a nursing home. So they call those home and community-based services, and it's the right thing to do. It allows people to live with independence and dignity. It's also the fiscally prudent thing to do because it's much cheaper to give people some support services in their homes and have them go to a nursing home or a facility. So we always fight for those and for the funding for those. And the governor's budget, his proposed budget, was going to cut the home and community-based services. So what we did before the session started, AARP, we sent a letter to the governor and to legislative leadership saying during the special session, please protect the funding and the home and community-based services so people could continue living safely at home. We also had our members get involved, and what our members did is they sent letters to their individual legislators during the special session saying protect the home and community-based services. And as a result, some of the things that were added back, and you've heard there were many things added back, the home and community-based services were held harmless, so there were no cuts to home and community-based services. Some of the programs actually were restored to their full levels, and then there were even some other services, some Medicaid services that were added. So the home and community-based services will continue with the funding they've always had, so people will be able to continue living at home where they want to be.
And for our members and community, I just want to let all of us know that while we weren't physically in the building, we still continued to advocate and call our legislators and send letters to the governor, because these were services very important to our homebound individuals. We saw during the months that led up to this that, you know, there were more people going back to the home, staying home because they couldn't go to the senior centers. There were more Meals on Wheels. There were more services that needed to be brought in. So bravo, Barry, you did a good job engaging our members and making sure that these services were not cut. Talk to us a little bit about the disability area, because aging services is the disability community is part of that funding. It's aging and disability services. So tell us a little bit about what happened in the disability community.
Absolutely. So, you know, there's several different programs that provide these in-home services, and it's a wide range of services. It's things like Meals on Wheels. It's things like helping someone take a bath, doing personal care. There's things light housekeeping for people that aren't able to do that. So it's a variety of services that keep people living independently, so they don't have to go to a facility and live in a nursing home. So in the disability area, one of the things that was added back was personal care. So some of those personal care services, which is like helping people take baths, helping people keep up with their household, things like that, those were set to be cut, and those were actually restored to the budget. So we're really pleased because a lot of people, a lot of AARP members, and a lot of people in the community need that kind of help. So those are things that were added back to the budget, and they found other ways to find the money to do that. So we were really pleased that the most vulnerable in our state will continue to be able to receive the services so they can continue to stay safe at home.
And Barry, when we talk about the disabilities communities, we're talking about all ages. Is that correct?
Absolutely. Well, actually, not all ages. What we're talking about in these programs are people over the age of 18. So it's like 18 and up, and some of the senior programs actually are for people of all ages, but these are not children's services. These are
I think it's important for our community to know that while people view us as a 50 and older advocates, we really advocate for all. So a lot of these programs that we are actively advocating and asking our members to write letters and contact their legislators really affect the spectrum from 18 on up. So thank you. So Barry, I also want to ask you about Medicaid. You know, sometimes we get the Medicaid, Medicare, all those programs, we get them all confused. So tell us a little bit about what happened around the Medicaid issue in our state during this special session.
Okay. Well, some of the home and community-based programs that we discussed earlier are Medicaid programs and Medicaid services that did get some of the proposed cuts added back to them. So there are Medicaid services, and then some of those home and community-based services actually are non-Medicaid services, and so there are some other people that are getting those. So, but there were some other Medicaid services that you heard about that were particularly unpleasant to think about. One of those was prosthetics. So let's say you need an artificial leg or you need an artificial arm. One of the proposed cuts was we're not going to allow people to get any new prosthetics if they were over the age of 21. So let's say your artificial leg breaks, or I don't want to say you lose it, because I don't know if that would really happen. So if something happens to your prosthetic, they weren't going to let you get another one. And if you think about that, that's a pretty awful thing to think about. The legislators used their wisdom and said, you know, we really need to protect the people living in our state. And they found ways to add some of those other services back in. So, you know, there were those kinds of things. There were other services, optical and dental, and some of those, you know, might have changed just a little bit, but they really decided that some of these services that people receive, and these are the most vulnerable among us, people on Medicaid are low income for the most part, and usually have pretty severe needs to live in the home. So our legislators, through a lot of the advocacy that was going on by a lot of the groups, um, saw the reasoning behind that and were able to make sure that the most vulnerable were protected in our state.
And Scott, I know that we have had a very active communication channels going on. We were sent home in mid-March, and as a result, people really wanted to know up-to-date information, and we have linked a lot to our website, and not only COVID-19 related, but how to stay safe and how the special sessions. So can you talk about how we're communicating with our members in the community during these times?
Yeah, no, Maria, it's so important. And that's, you know, obviously doing the video, what we're doing today is part of that. And that's really just making sure Nevadans and our members and our community have as much information they can. Luckily, they have resources like Nevada 211, for example. You can call 211 from your phone. You can go to the website, nevada211.com, and link to a lot of those resources. But we're also doing on our website, Maria, as you know, is we are updating weekly resources, things like that during these times, so that people can go there and find kind of a one-stop shop. You know, everybody's got a different trust level with different organizations and different websites and things like that. So you can go there, you can find that information. It's updated weekly. It's everything from caregiving to medical, for telehealth. It's community-based resources that you and Barry have been talking about protecting in the state legislature. It is veterans issues, because our veterans have issues that are unique to them as well as things like unemployment and all those things that impact all of our residents here in Nevada. And like you said, Maria, yes, we're an organization and we're focused on 50 plus, but that doesn't mean the caregivers for everyone that may be aging in our state, they're not all over 50. So all the issues that we deal with go across the spectrum of age, and it really is multi-generational. So I invite people to do that. You can also connect, of course, the website, but also the Facebook page. We do a lot. We have a lot of engagement. People there right now are watching this. They're watching this on Twitter, and they're watching this on YouTube. By the way, you can ask questions. If you have any questions for Barry and Maria, just type it in the comment section below the post, whether you're in Facebook, Twitter, or YouTube, and we can answer your questions and we'll show them on the screen. But Maria, that's the case. You know, we all have to stay connected. Luckily, technology does that. For those people who are not as connected electronically, though, too, obviously 211 is a great resource, and I know we've worked very closely with them, and Nevada Can, a great initiative as well, to make sure people are updated as this continues and as we all try to help one another stay together and stay connected.
And as a follow-up for Barry, I think it's important that we understand how, even though we're talking about the special session, we also want to let our audience know that a lot of these special session issues also have national implications. So Barry, can you talk about the nursing home implications and what we're doing nationwide as it affects our state?
Absolutely. We all know that people who live in nursing homes are especially vulnerable to the pandemic and what's going on right now. And AARP has been working all across the country, nationally and in states, to make sure that nursing home residents are protected. Things are going well for them. You know, people aren't allowed to visit, so we need to make sure there's things going on. So AARP Nevada, early in the session, we wrote a letter locally to our governor and to the head of Health and Human Services in Nevada, making sure that there was enough protections for the people living in nursing homes. That the staff had the necessary PPE. Who would have thought that we all would know what PPE stands for, personal protective equipment? Make sure there was enough PPE and testing and all that stuff to make sure that our nursing home residents were protected and that they could have virtual visitation. And that wasn't happening just locally. That was going from state to state to state, as well as nationally. We were reaching out and asking that to be done in Congress. And we're reaching out in Congress right now. If you are an AARP member, and I know you get emails from us, you got an email asking you to contact your member of Congress saying that the next stimulus package should include protections for nursing homes. Some states are actually, Nevada's doing pretty good in terms of some of the protections and the things we're doing in nursing homes, but in some other states, there's some really bad things happening, is the best way to put it. So AARP has a 5-point plan, and that's part of the email that you may have received. Reach out to your member of Congress, tell them we need to make sure that the next stimulus package protects everyone in the nursing home. And our 5-point package includes regular ongoing testing, personal protective equipment, transparency on public reporting. Nevada is very good at reporting how many people are getting COVID-19 in the facilities and the staff members. So we're really talking about that, and contacting families, making sure they're contacting families when they're discharged, requiring access to facilitated virtual visitation. Just saying we allow it isn't good enough. We want it to be required so people can have visitation virtually from their loved ones. Making sure that there's adequate staffing, making sure that there's in-person advocacy people can get in, the ombudsman. And then also, we also worried about, there's some states that have just blanket immunity for long-term facilities related to COVID-19 patients. We need to make sure that the nursing homes and things that are going on, that there is some liability, that they are being oversight. So we need to make sure that those people are protected, because again, that's another very vulnerable population. So we're reaching out to Congress and hoping that that will be included in the next stimulus package. So far, some of those things don't seem to be included, and AARP came out with a statement yesterday about the first version of the HEALS Act, which is still a long way from being passed, and we're still looking for that. There's some stimulus, there's some needed economic relief for older adults, like in those stimulus payments, but we need to make sure that people in nursing homes are protected as well.
And you bring up a really important topic. It's caregiving, and a lot of the nursing home issues, and a lot of home and community-based issues, and a lot of disability issues. Many of us live far away from our parents. So Scott, in addition to going to our website for the latest information on our website regarding Nevada, if you are someone who's looking for help in, say, New York, how's the association, how's AARP connecting our members from state to state?
It's a great question, Maria, and that's been very big. I mean, just like the rest of the country and the rest of the world, when all this started happening, the organization realized that, look, it's all hands on deck when it comes to this, and needing to protect our families and needing to protect especially those that are most vulnerable. So going to the webpage, aarp.org/coronavirus2, you can see the latest there, from news about everything from vaccine trials to how to stay protected to avoid fraud. Because that's another thing, that with all this going on, as terrible as you would imagine somebody would have to be to try to take advantage of it, there are a lot of people doing that. So we are at the forefront of that. It's a huge initiative, as you guys all know out there, for AARP to protect people from fraud. And so we're doing all of that. We're making sure that people understand that every week on Thursdays, for example, today, we have coming up at the top of the next hour, we have a national teletown hall that you can go to for free and find information on the website aarp.org about that as well. So Marie, it's a multitude of really great, I think, communication vehicles, because everybody's kind of separate right now. We're not as social as we used to be, even though some things are opening up in certain communities. We're making sure that we're making those connections, phone trees, all sorts of different things to make sure that we stay in touch. And that's important as a reminder to everybody out there in the state of Nevada too, is if you have a neighbor, if you have a friend, you have a loved one who might be on their own and they're aging and in that group, and they can't be around a lot of people because they have underlying health conditions, make sure you stay in touch with them. Isolation is a big issue. And so we want to make sure that we do that. And so that these digital channels, things like we're doing today, being connected to people makes a huge, huge difference.
Thank you, and I have to really give a lot of credit to Aging and Disability Services Division. They immediately brought up something called NV-CAN, Nevada CAN, and again through the 211, you can get all these services. But in addition to just our AARP resources, I want to be clear that we have linked a lot of different statewide resources that we are consistently updating. We want to be sure that the latest information is up there. So if you go to our AARP.org AARP.org/envy, it's not just about AARP resources, but what is available in the community. So Barry, let's talk a little bit. I know that we're wrapping up the special session, and now we're hearing that there's another special session coming up. Can you talk a little bit about what we anticipate, what we're going to be hearing in the next special session coming up?
Well, the governor, I don't believe he's released a formal announcement, and he gets to decide exactly what issues will be in the next special session. We've heard a few things, and one of them that we know is going to be included, because he actually said it in one of his COVID-19 briefing, is going to talk about elections. And that's something that is very, very important to AARP. We've been involved in voter engagement for almost 35 years. And what it's all about is ensuring voters have access to voting and making sure it's safe voting. So we will be very involved with the second special session. There may be a couple of other issues involving, some other major things that are going on in the country right now, but elections will be part of that. The governor hinted at that during his briefing. And so AARP has a campaign that will be starting, voter engagement campaigning, that'll be starting next week. Stay tuned and you'll hear more about that. And what we'll be doing is making sure that people can vote safely wherever they're going to be. So that means vote safely from home, to vote safely in person. So we'll be involved in the special session, and they're going to be talking about different ways that'll happen. Nevada is what's called a no excuse absentee ballot state. It means if you want to get an absentee ballot, you don't have to have a doctor's note, or you don't have to have a reason. You can just request one. If you remember back to the primary back in June, they went ahead and they automatically mailed absentee ballots to all voters. And that's a positive thing, but there are a lot of people that still want to vote in person. So you need to make sure there are polling places that are safe and are using distancing and all that kind of good stuff, and masks and cleanliness. So we'll be following up on that. And also early voting, since the general election's going on, you get a lot more people who participate. So AARP will be involved with the special session and elections to look at wherever they're going to go to make sure you can vote safely at home and in person, and probably including early voting in that. So we'll be doing a lot of stuff, sending letters to the governor, and also reaching out to all of you who are living at home, all of our members and people who get those action alerts. Contact your legislator to say, hey, make sure that voting safely is included.
And thank you for that intro. AARP a few weeks ago, we thought we were going to be able to go back to our office safely, but we have determined as an association across the nation that we will not be doing any in-person engagements. We will not have any activities. Everything will be virtual. So knowing that everything is virtual, Scott, what are we doing around voter engagement? And how will we be connecting? I know that you were working with the Secretary of State. So can you tell us a little bit more about what our members can see coming up in the next few weeks?
Sure, Maria. Having some trouble with video. I'm assuming you guys can hear me though. Yeah, so there's a lot going on. What we're going to do is we're going to.
So I believe he is having a little bit of technical difficulty. I hope you all can hear us, but what I do know is that next week we're launching our voter engagement across the nation. And one of the things that you can look forward to in your bulletin is a conversation with the Secretary of State's office on how to vote and where you can get information. And as Barry said, during a special session, we will be sure to update our members frequently about what is going on in the state of Nevada and how you can stay connected either through volunteering or either through engaging with our elected officials and asking questions around our priority issues. And Barry, can you talk a little bit about what our priority issues will be and what's important, what we're hearing from our members?
Absolutely. Our members have told us over and over again that priority issues in elections when they look for candidates who to vote for is protecting Medicare and protecting Social Security. Those are big issues in healthcare. Social Security and Medicare are the biggest issues. And also right now, another top issue is COVID-19, the response to COVID-19. So we mentioned the special session. They'll be making decisions during the special session about how the elections are going to be run. Will they be mailing ballots to everyone or not? How many polling places will there be? What will early voting look like? So we'll be sure to update our website, our webpage with all that information, because some of that probably will change. As of right now, they're planning on having a quote unquote normal election all in person. And if you want an absentee ballot, you have to actually go and apply for one to have it sent to you. But those are the issues they're going to be talking about. And we're going to be asking our members to get involved in and tell them how you want to see it happen.
So look in your bulletin, that special piece is coming up that you'll hear from Scott in that bulletin piece, but we'll also be hearing from the Office of the Secretary of State. So Scott, any voter elections, I know you were having technical difficulties. And as a reminder, we do offer Zoom classes to our members and all other classes. So if you want to stay connected, look on our website. Anything else coming through the communications channels that we need to pay attention to?
Yeah, you'll see a lot. We plan on really doing more of this, right? So the idea there is, as things pop up and we understand the issues and what's going to happen in Nevada around voting, is to really just keep you updated on the latest. So I know that you talked about the bulletin, you talked about the talking with the Secretary of State's office. We're going to update. It's evolving, it's changing with this special session coming next week, as well as we've talked about. Things may change, and to Barry's point, I think that's where we have to be the leadership here and say, hey, look, we're going to keep you up to date. So in our communications channels, you can see the latest. We will stay on top of that, including giving instructions and easy to understand, looking through what they've done and giving you the kind of plain English of what it means to you. Because I think a lot of times people read about the legislature, even me, I say, okay, what does that mean for me? And so I think that's what we're here. We're here to kind of interpret it for you and say, hey, listen, what this means is you can vote from home, or if you want to vote in person, you can. You're still going to get a ballot in the mail. You don't have to send that in. You could take it in, walk it in, and vote in person. So we'll do that. So I would say stay tuned to things like our Facebook page, right? So go like our Facebook page, like us on Twitter, so that you can see what's going on, because we will be doing that. We'll also be sharing the views of our members and volunteers to say, hey, listen, why are they voting? Why is it important for them to vote? Again, we are a nonpartisan organization. We don't tell you how to vote or how we think you should vote. We just give a voice to our membership and our volunteers so that they tell you why they believe it's so important that you go out and exercise your constitutional right to do it. And so stay tuned to those channels, and we'll be there updating them constantly.
And if I might add, Scott, the 50 plus is the largest voting block in the country by far. So we decide elections. People over 50 decide elections. So you have to get out, you have to make your voice heard, and you have to let them know what you're thinking. So voting is a great way to do that. During the special session, you should also reach out and contact your legislator. They want to hear from you. Tell them what you want them to do.
And I just wanna, I know we're getting ready to wrap up because time is running up on us. But just because we're not physically in the office, just because we're not physically out there in the community, our doors are open for business. So as Scott says, I'll send it over to you, Scott. Maybe you can tell us a little bit about staying in touch and a little bit about everything else we're doing as we close this session out.
Sure, yeah, you can see at the bottom of your screen right now, if you want to stay in touch on these issues, especially here in Nevada, because usually we don't have a state legislature every year. We don't have a session every year. This is a special session because of COVID-19. Make sure you sign up action.aarp.org. That allows you to get really issues related to all of this sent to you in your email box. We don't spam you with it. We just send you important alerts that you need to know about so you can keep in touch with it. So I would do that because that's going to help. It also allows you to just know when the sessions are in and what's going on. We also give you, Barry does some great post-session wrap-ups to tell you what it means and to tell you where things went well and where we still have concerns. So do that. Of course, we mentioned the Facebook page. Like the Facebook page there. We have a lot of engagement, good discussions there. We have a lot of video like this. And other things, other resources that are available to you to do that as well. And of course, the website, the main website where you can go and see all of this is aarp.org/NV, where we update, again, the resources pages around COVID-19 to keep you up to date on the latest. But also, if you want to know our events, Maria mentioned a little earlier, Zoom training. So if you're trying to connect with people and go to Zoom meetings and you're having trouble, Just because we're not in the office doesn't mean AARP is not out there doing our community-based work, and we're doing it virtually now. So make sure you check out the website. All the events are listed there, whether it's event around veterans or caregiving or fraud, or even driver safety, which is a huge program that we have here in the state. Those are things that you can find there. So make sure you're connected with us. And if you're connected with us, you'll get the latest and greatest information.
Thank you. Thank you, Scott. Thank you, Mary.
All right. Well, that's going to end the session here. I want to thank again, of course, our state director, Maria Moore, for doing that, as well as Barry Gold, our director of government relations. Again, make sure you stay connected, aarp.org/NV. Follow us on Twitter, of course, at AARPNV, and like the Facebook page where you can find a lot of information and connect with one another too. Also, AARP.org, you can go there for a national. We have here at 10 o'clock, another half hour, our national weekly teletown hall during the COVID-19 crisis, where you can hear the latest and greatest government officials, experts, doctors, people who help present fraud, everything. So make sure you do that, and we certainly appreciate you guys being here. So for the entire state staff here at AARP Nevada, we want to thank you for being with us. Make sure you stay tuned for other live videos as they come up. Have a great weekend, everybody, and stay safe, stay hydrated, and stay cool. Take care.
Today is full of opportunity to connect with others, grow as a community, and even improve lives. And AARP is in Nevada, helping to make it all happen, with resources to help you steer clear of fraud, helping to make our community accessible for all, and fun and educational events all over our state, because AARP has real value for you, your family, and for everyone in Nevada. So let's take on today together. Learn more at facebook.com/AARPNV.